Good afternoon, sir.
Good afternoon.
Please, I want to be the pharmacist. I want to get
Okay,
the
I'm the
job.
pharmacist. Okay. Oh, okay, I'm saying cefixime 400 milligram BD for 5 days. Levofloxacin 500 milligram BD for 5 days. Diclofenac 100 milligram BD for 5 days. Okay, so if I may ask you, now, what wants to use this drug?
How's one of your business? Is written already.
Okay, none of my business.
Yes,
Okay,
yes.
so that means you don't need the service of the pharmacist. Probably you can just walk up to the pharmacy technician over there, just show her this, and she's going to give you a drug. Thank you.
Whatever.
Oh, I don't know where we're going to start from today, but let's just start from what drug therapy problem is. Okay, there's something called drug therapy problem, and just like the name sounds, problem associated with drug therapy. Not all times that you bring prescription, that you just expect your pharmacist to give you what you have in your prescription. Your pharmacist have the right to ask you questions pertaining to your prescription. When it comes to doctors, they are trained in terms of diagnosis, prevention, and treatment of disease. But when it comes to the drug therapy itself, no one knows it better than your pharmacist. So your pharmacist is not a patent medical formula that you just visit and then they just prescribe whatever you have in your prescription to you without asking any question. A good pharmacist should ask you questions because we have different kinds of drug therapy problems, such as dosage too high. And from that word dosage too high, that means sometimes your doctor could recommend certain medications and that their dosage will be higher than the normal dosage that you need. That's not a problem with the doctor anyway. That's why we have a pharmacist to help sort out that. So your pharmacist can check your prescription and refer you back to your doctor to change your prescription for you. And sometimes the dosage prescribed by the doctor might be maybe lower than what is expected, and that's what we call dosage too low. And okay, the next one we're going to be talking about now is what we call unnecessary drug therapy. And when it comes to the aspect of unnecessary drug therapy, what we're talking about is sometimes some medications are being recommended which are actually not needed by the patient. Well, because of the busy state of hospital most of the time, your doctor may not have all the time to clock you for a very long time. So sometimes they just assume and give you certain things. Yeah, that's the work of the pharmacist to be able to discover, okay, is this particular medication needed for this particular kind of condition that you're having? So that's what we call unnecessary drug therapy. So I've seen many patients walk into the place with prescriptions, and I try to ask them, okay, what are the complaints that you made to the doctor, only for them to tell me things that does not even pertain to the prescription they were being given. So it's the work of the pharmacist to verify that and send it back to your doctor so that the doctor can review his medication. So now imagine a pharmacist now trying to ask you a question, and then you are kind of shunning the pharmacist or boning your face like my doctor has said, and look at this woman that just walked out of my presence now that I asked to go and see the pharmacy technician now. She actually came with a prescription with a drug therapy problem, and there are two major drug therapy problems in that prescription. Number one, she was asked to use cefixime 400 milligram twice daily. Me looking at the prescription, it's obvious that it is not from a medical doctor. I can 100% say that it's not from a medical doctor at all, because no doctor will ask you to use 400 milligram of cefixime twice daily. That's actually very wrong. And not just that, she's using cefixime and then levofloxacin with it for what? I don't know the problem actually, but combining that high dose of cefixime, the normal dose of cefixime is just 400 milligram once a day. So for her to be using 800 milligram per day, that's 400 milligram BD as prescribed in that prescription, is actually way too high. Even that 400 milligram daily still cause what we call CDAD, that's CDAD, clostridial deficit associated diarrhea. I've seen some people presenting with that symptom after taking 400 milligrams of cefixime per day. And this CDAD can actually be sometimes fatal. So imagine this person now using 400 milligram morning and night, and she now begins to develop those kind of symptoms. It may be fatal for her. Now the pharmacist is trying to question her, and then she's trying to kind of give some attitude. That's actually very bad and it's not safe for her. And imagine the kind of drug therapy problem that we have in a drug, which can actually lead to a death self. Who knows? So whenever your pharmacist is trying to ask you questions, if they are right, they need to ask you questions. And in fact, they may need to send you back to your doctor to change your prescription if necessary. So when your pharmacists are trying to question you, they are just doing their work. Thank you very much.
What about you said earlier? I'm very
Okay.
sorry about what
No problem.
happened.
We've seen so many cases like that before. You just need to be patient whenever your pharmacist are asking you questions. Eh? Okay, no problem.
Can you please help me with this now, sir?
Okay, okay. Now, number one, now, please, can you tell me the truth? Is this prescription recommended by a doctor? Is it a prescription written by a doctor?
No, actually. It's one woman that stood beside
A,
us that gave me this.
a woman that stays around
Uh,
you, okay? Okay. So it's not a, she's not a medical doctor.
no,
She's
she's
not
a
a medical
nurse,
doctor.
actually.
Okay, number one. There's something we call clostridioides difficile associated diarrhea. That's CDAD. And when it
Mm,
comes to STIDAD, that kind of diarrhea sometimes can be fatal, and it is usually drug induced. So one of the major drugs that usually causes is cefixime, and even levofloxacin that is being prescribed there in combination with cefixime also have the tendency of causing STIDAD. So there is high chance of you having STIDAD after taking this. Hmm?
mm,
So what I'm going to advise now is that wait, in the first instance, why did she recommend this? What was the complaint? Why
mm.
did she recommend all this for you?
I was having stomach issues for some days now, so that's why she gave me this.
Stomach issues for some
Yes,
days.
yes,
How many days? Like, is it up to 3 days?
like 2 to 3 days
Just two
now.
to three days, and then she's writing cefixime 400 milligram BD, levofloxacin 500 milligram BD, and even diclofenac. Are you having ulcer before?
Yes,
You're
yes,
having ulcer, and now I'm
yes.
seeing diclofenac 100 milligram when the maximum daily dose for diclofenac is even 150 milligram for a normal state. You only give up to 200 milligram for very severe pain and the like. So this is even way too much for you. Way too much for you. So this is what I'm going to advise. I'm going to give you some over-the-counter drug now that
Okay.
you are going to just take things like just Buscopan to relax the wall of your stomach and one or two other things like an antacid or so. Then you watch between now and tomorrow morning. If you didn't see any change, then you can go to an hospital to see a medical doctor. So let them give you a proper examination so that they can give you the right prescription. Do you get that?
Okay,
So we
sir.
can go over there to meet the pharmacy technician. I'm going to tell her what she's going to give you. Hmm? Thank you very much. God bless you.
Yeah, thank you, sir.
Thank you. Okay, so it's not more than that. Can you see now? So whenever the pharmacist are asking you a question, just answer them calmly. Answer them calmly. So that will help them better. So take for instance, we just dispense whatever this woman claim her doctor initially what she initially claimed her doctor prescribed for her, we just dispense it to her and then she came up with all kinds of side effects and the likes that can even be fatal sometimes. Only God knows what would have happened. So whenever a pharmacist are asking a question, they are actually doing that for you. Thank you very much for your time. So I'm Pharmacist Jesulade. For more content like this, you can just subscribe to our YouTube page that will be seen very soon. Thank you very much for your time. God bless you.